You'll get the signal. Start. Good afternoon. My name is Barbara Collins. I am President and CEO of Humber River Hospital. I would like to welcome Premier Doug Ford, Minister of Health Christine Elliott, Solicitor General Sylvia Jones, Parliamentary Assistant Robin Martin, and General Rick Hillier. Thank you to all of you for being here for today's announcement, and thank you for your leadership during this COVID crisis. It has been an honor over the past year to watch the Humber River Hospital team, in partnership with our community, come together to adapt and continually offer the highest quality of care to our patients and community members through very difficult times. I am so grateful to our frontline staff and physicians who have taken on key roles throughout this pandemic. Thank you for your continued service and your willingness to help. Throughout the pandemic, the role and the responsibilities of hospitals has grown and evolved as we have identified the most pressing needs of our community and the province. At Humber, this includes our COVAX clinic that has provided COVID-19 vaccinations to almost 45,000 community members. We are proud to support the expansion of this clinic by moving to this location at Downsview Arena, where we'll be able to accommodate more individuals and continue to support Ontario's vaccine rollout. In addition to this expansion, our community outreach program of mobile clinics continues to play a significant role in increasing the accessibility to vaccines. In addition to providing continued immunization services to residents and patients of 38 long-term care homes and retirement homes, our teams and our Northwest Toronto OHT partners have been traveling to neighborhoods hardest hit with COVID-19, providing access to COVID-19 vaccines in apartment buildings and congregate settings. Our thanks to each eligible Ontario resident who has taken the time to be vaccinated. The most common comment we hear as we give vaccines is, "I just want to hug my children and grandchildren." Vaccines are key to returning to those hugs, so please do your part. Get a vaccine, a COVID-19 vaccine, as soon as you are eligible. And just one more thing I want to add. Please remember, if you've booked an appointment and for some reason you don't need it, please do us a favor for any of the organizations that you've booked at and take a moment to cancel that appointment. A wasted appointment is a wasted opportunity to give a vaccine. Ontario's vaccination program would not be possible without the many individuals working tirelessly to coordinate logistics and oversee the distribution network across the province. That is why today I also want to recognize General Rick Hillier's work as the head of Ontario's COVID-19 Vaccine Task Force. Despite unprecedented circumstances, General Hillier has provided incredible leadership and guidance to our province. As he steps away from this position, effective tomorrow, we commend and thank him for his significant contributions in getting Ontario's vaccination rollout to where it is today. We know he is leaving the vaccination plans in the very capable hands of the teams at the Ministry of Health and the Ministry of the Solicitor General. Developments and progress continue to be made with Ontario's vaccine rollout. Premier Ford is here today to share more details about how Ontario is expanding and strengthening the vaccination process. Thank you, Premier Ford, for taking the time to be here today and continuing to trust Humber River as we work together to serve Ontarians. It is my pleasure to introduce our Premier, the Honourable Doug Ford.
Oh, thank you so much, Barb, and good afternoon, everyone. And thank you for the kind introduction and for the tour of this mass vaccination clinic. On behalf of myself, Minister Elliott, Minister Jones, and General Hillier, and all Ontarians, I want to say thanks to everyone at Humber River Hospital. Our family has a real special spot in our heart for the folks over at Humber. And to all those in the community who have come together to set up this clinic. As Barb said, this has been a true team effort. This clinic will have over 600 people working here with the ability to deliver upwards of 1,800 doses a day just to start. Clinics like this are vital to our provincial vaccination plan, a plan that was developed by General Hillier and our vaccination task force. We're thankful to the General for what he and his team has been able to accomplish in such short time. The infrastructure they've put in place is absolutely critical. Over 250 planned vaccination sites, including mass clinics, hospital hub sites, and mobile clinics for the month of March, as well as over 1,500 pharmacies and primary care sites by the end of April. Our ability to get needles into arms grow by the day, but the supply of vaccines, it isn't keeping up with our capacity to deliver them, not even close. We still don't have the steady and reliable supply of mass vaccines that we need from the federal government. And this ongoing instability is the biggest threat to the success of our vaccination plan. Because of the General's tireless work and the leadership of hospitals and public health units, we have everything in place: the people, the plan, and the infrastructure. But we simply don't have enough vaccines or a guarantee of when we will get them. After learning that the shipment would be cut in two, we now know that the Moderna vaccines are delayed again. They won't arrive until next week. As a result, mass vaccination sites, including 3 in York Region alone, will pause operations. And while AstraZeneca has landed in Canadian soil, we will still have no word from the federal government on when we can expect to receive that. Every day delayed is a day we miss out on putting more needles into arms. In fact, some pharmacies are being forced to stop vaccinating because they're basically out of supply, while others are ready to ramp up but are still waiting. And I want to be clear, every single dose is accounted for with a booked appointment. To really ramp up to meet our full potential, we simply need more vaccines. It's as simple as that. Friends, the progress we've made to date is significant. Ontario has now administered more than 2.1 million vaccines, by far the most in any province right across the country. Our great neighbor, Quebec, comes the closest, having administered approximately 1.3 million doses. In Ontario, nearly 80% of residents 80 plus have now received at least one shot. Nearly 45% of residents aged 75 to 79 have done so as well. Overall, nearly 15% of all residents 60 or over have received at least their first shot. Team Ontario is ready to go. We're making progress, and I can assure you, our government is behind you every step of the way. The 2021 budget brings the government's total investment to protect people's health to $16.3 billion dollars. Our COVID 19 action plan now totals $51 billion dollars. Bottom line, we are sparing no expense to protect individuals, families, and workers, and will not stop until everyone who wants a vaccine gets a vaccine. Before I close, I'd like to take a moment to acknowledge General Hillier. 4 months ago, when we launched the COVID 19 Vaccine Distribution Task Force, we knew we needed some big guns to tackle the monumental task. General Hillier's logistical expertise and insight have been critical to ensuring the success of Ontario's vaccination program. Thanks to you and your team, General, we have now administered over 2.1 million doses of vaccines across the province. Your team has developed a solid plan that will carry us to the finish line. We couldn't have achieved this level of success without your leadership. Your dedication, determination, and professionalism has been inspiring. On behalf of myself and all Ontarians, thank you, General. Now I'll pass the podium over to you.
Premier and Barb, thank you so much for the kind remarks. And as I stand here on what will be my last press conference with the Premier in this role as the chair of the Vaccination Task Force rollout, I just want to say it's been a privilege to work for the people of Ontario. And as we leave here now, tomorrow, the last day of what was our phase one, we are content that the work is ongoing, almost completely ready, and ready, as the Premier said, to receive simply more and more and more vaccines. By tomorrow, we will have 2.2 million vaccines in the arms of people of Ontario. Just think about that for a second. 2.2 million vaccines in the arms of the people of Ontario. And it was only just 4 months ago, we didn't have a single vaccine here in Ontario, and now 2.2 million into the arms of people in Ontario. Yesterday, we did almost 70,000 vaccines and 26,000 before lunch today, and it will carry on right across the province as long as those vaccines keep coming in places like this. And there are several hundred of these mass vaccination sites right around the province, and every public health unit, in hockey arenas like this, at hospitals, or in other convention centers or like the Congress Center here in Toronto also. And they are ready to put tens of thousands of people per day through to receive that vaccine and get that level of protection that we all want them to have against COVID-19. And these things don't happen by accident. They happen with a lot of work from literally tens of thousands of people. And I know just off to the left-hand side, there are a lot of the folks here from Humber River Hospital who have worked to put this clinic into being here and to be ready to give those vaccines and that level of protection to the people of Ontario. And I just want to say thank you to them for their work and for what they bring to all of the people of Ontario. Thank you so much for what you do. It truly does deserve a round of applause because those 2.2 million vaccines didn't happen by chance. It is compliments of the work of people like this. But in addition to all those mass vaccination clinics, we've got now 700 pharmacies ready to go with AstraZeneca when it arrives, and ready to more than double to over 1,500 pharmacies in the next 2 weeks after that, so that there are pharmacies with AstraZeneca in every single public health unit around the province of Ontario. Primary care professionals, family doctors are ready to deliver those vaccines also as soon as they arrive. The capacity is enormous. We are not stressed in that capacity and would like to get as many vaccines as we possibly can. As we stand here right now, we are literally weeks in front of where we thought we would be back in December and January as we were building the plan. And we thought it would be early April before we got into 80-year-old and above people in Ontario. And here we are now vaccinating those who are 75 years old, 70 years old, and ready very soon, I know, to drop down to even lower age brackets and get the mass of the population as much protection as that one needle can bring to them. I simply want to say thank you to the Premier for his leadership. Thank you to Minister Elliott and Minister Jones for their leadership. I had the opportunity to work most closely with them. And thank you to my two battle buddies, Deputy Minister Helen Angus and Deputy Minister Mario Di Tommaso. I could not have asked for better leaders to work with. Thank you to the entire team from Solicitor General and Ministry of Health. And thank you to my small personal team. You all know who you are. I just want to say none of this would have occurred without your leadership, without your vision, and without your work. Thank you so much. I will support from here in the wings. I told the Premier I'm a call away if he needs anything more, but actually I don't think he will. We've got the leadership in place. They'll deliver on the vaccination rollout from here on in. And I still believe that by the first day of summer, 20 June, given delivery of the vaccines, we will have a needle in the arm of every eligible person in Ontario who wants one. Thank you.
We'll go to the phone line for questions. First question, please.
From Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Hello, Premier. There's a lot more pressure in the last few days for more action to quell the pace of infection. So you've heard all this concern about what's happening in hospital ICUs. They're almost at where they were in the peak in January. Are you sticking with the plan with the tier, or are you considering moving out of the framework and into more stringent measures?
Yeah, Rob, first of all, I'm extremely concerned on the situation that we're seeing and the numbers going up. I'm also very concerned about seeing the age group, the younger people now in ICUs. Everything's on the table right now. So folks, be prepared. I'm asking you, don't make plans for Easter. That's what I can tell you. I won't hesitate to lock things down if we have to. I did it before. I'll do it again. Nothing's more important than our health. The economy, yes, it's important, but that can wait. Without people's health, we won't have an economy. So everything's on the table, and I'll be out over the next couple of days. But please, I'm asking folks, don't make big, huge plans with family members. That's where the problems start. So that's my request.
Follow up?
In retrospect, do you wish you'd taken some more action sooner? It's the repeated criticism is that you wait too long to act and things get worse than they need to be. So are you taking that into account? And it does sound like we're going to see some tougher measures very soon.
Well, Rob, every decision that I've ever made was through the advice of the Chief Medical Officer, and I've taken his lead right from the beginning. And I know he works collaboratively with the local medical officers of health We were hitting below 1,000 cases. Things were looking a little rosy. And I took the advice from the chief medical officer, and I will continue to take the advice. But I won't hesitate, believe me, to lock things down until we can protect the ICU capacities at the hospitals.
Next question.
From Laura Stone at the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Premier. Just on that note, I mean, you say you've taken the lead from Dr. Williams the whole time, but your government over the past couple of weeks has significantly loosened measures in the lockdown regions. I mean, surely that came from you and your cabinet, did it not? What was behind the measures to make lockdowns less restrictive than what they were before?
Well, in the two gray zones immediately here, be it Peel and Toronto, we had a lot of consultation with the local medical officers of health, both of them. They both agreed, along with the chief medical officer, to put a recommendation forward to our cabinet. I had deep conversations with Mayor Tory and the mayors in Peel as well. Everyone was on the same page. Make no mistake, we have to be cautious, and that's why we had the emergency brake available, which we've used a few times in different regions, and we won't hesitate to do it again here in Toronto. Really, Laura, no matter what we do, I'm not just asking the people, please. I know the weather's really nice out there, but we can't let our guard down. We can't be gathering. I see it. You drive around, you go to the parks, you go to other places. We're letting our guard down a bit. We just can't do that. This is critical. So we're almost there. We just have to be vigilant.
Follow up?
Okay, our case is coming from sitting outside in a park, but I do have to move on to vaccines. I mean, you continually say that you're looking for more of a steady supply of vaccines, and then the federal government says 1 million doses of Pfizer a week in April and May, and in June they're now going to increase the expected doses just from Pfizer to 9.6 million. So is this now enough of a steady supply for the province, and are you using this supply argument as to veil yourself from criticism that you're not moving fast enough or enacting a more targeted strategy to reach the most vulnerable population?
No, I don't play those games. Let me tell you straight out, it's root cause. Myself, you can ask any medical officer of health, you can ask the general. It's a real issue when we think we're going to have vaccines. Wonderland, for example, we thought we were having Moderna, 5 changes. I'm not here to go after the federal government. They've been good partners. At the end of the day, we just don't have the vaccines. When we have a capacity of 9 million, 9 million people we can vaccinate, if we had all the supply that we needed, then we'd be doing it. But it's an absolute logistical nightmare when you get ramped up and you got to take it back down. I think there's 3 sites in York it's happening to. Pharmacies are out of AstraZeneca. Again, I just want vaccines. That's it. I don't need to cover anything. We're working our back off. We have an incredible team. There isn't one person, one medical officer, I believe, or any hospital CEO will tell you we don't have the supply that we need. It's as simple as that. It's not about anything else. Let's just get the vaccines and we'll be moving up. And we've proved every single time we get more vaccines, the numbers of vaccinations are going up. And that's simple as that.
Next question.
From Sean Shepherds at the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier. I wanted to follow up on Rob's questions about additional measures that the province might be considering in light of the jump in cases we've seen. It sounds like you're saying that the government is looking at something else and that there may be additional word on that this week. I'm wondering if you can tell us, what this may look like. Is it going to be a kind of a short but pretty strict circuit breaker, or something else? And what are the measures you're using to determine when it would go into effect?
Well, right off the hop, we'll consult with the chief medical officer and obviously the science table, along with other medical officers, local medical officers, and and we'll get advice off them. Then the cabinet will make a decision. But I'll pass the balance over to the Minister of Health. Thanks.
But I think it's also important to note that we're not just returning to normal, that this isn't a situation where we're going back to business as usual. We do have the framework in place. We are following the measures. We do have the emergency brake if we need to use it. As the Premier has indicated, we've used it several times already. And we are in regular contact, daily contact with the local medical officers of health and with Dr. Williams and the Public Health Measures Table. So we're keeping a very close eye on the situation across the province of Ontario. And if we need to take action and put on the emergency brake, we won't hesitate to do that.
Follow up?
And Premier, I wanted to ask you today about long-term care. Advocates, families, residents are saying that even though vaccination rates in long-term care are rising, they are still having a lot of trouble accessing their families, even outside. I'm wondering if, the government needs to step in and tell homes across the province that, they need to try to work with families and advocates to get better access to these folks who really have been isolated for the better part of a year.
Yeah, that I fully understand. As I've always said, my mother-in-law's in there. Yes, my wife's in there as a volunteer healthcare supporter, but we have to be super cautious. And again, I'm sorry, Rob, I'm going to pass this over to the Minister of Health. Thank you.
Well, we do want to make sure that essential caregivers can have access to usually family members in long-term care, while the residents are by and large protected. Over 90% of long-term care residents have received both doses. But what we really need to do is to continue doing the testing. We're using the rapid test to make sure that anybody who goes in to long-term care can be tested to determine if they have any signs of COVID-19. But as for those essential caregivers, they are in the list to receive the vaccines quickly. We want to make sure that they can be there for the comfort of their family members and to provide a lot of the services that they provide to them as well. But I think testing is also a key element to all of this, and using the rapid tests that are available through the federal government. We've already used over 3 million of those tests. We receive over 2 million a month, and we're going to continue to use them, long-term care homes, retirement homes, and going further into places of work as well.
Next question.
From Christine Elliott at CP24. Please go ahead.
Hi, Christina.
Hi, Premier. Hi, everyone. Premier, you commented in this news conference about the challenges with young people and the numbers. So the majority of COVID-19 cases in the province are young people, 127,000 to date, between the ages of 20 to 39, compared to approximately 21,000 for those in the 80-plus group. I should point out, of course, 23% in the 80-plus group die, as opposed to 1% in the younger group. But the science table says 46% of ICU admissions right now are younger than age 60. Your government strategy with vaccines is based primarily on age, to vaccinate the population based on age, because the evidence shows that vaccinating on age with some adjustment for high-risk groups prevents more deaths, hospitalizations, ICU admissions. We aren't quite seeing that in the ICUs. Is it time to maybe adjust the strategy a bit here? And one critical care doctor here in Ontario, Dr. Michael Warner, has called out and said, look, get those people who are working in factories, those essential workers who are not, let's say, healthcare workers, vaccinated faster. Will you tweak the strategy a bit?
Well, first of all, our goal is to make sure we take the care of the most vulnerable. The most vulnerable was plus 80, plus 70, and plus 60. With phase 2, there are essential service folks that will be taken care of. I understand, Dr. Warner, I think he's a great doctor. I know he's always commenting every single day, but I listen to Dr. Williams and a whole other team of doctors that give me advice. So we're going to follow the advice, again, of the chief medical officer and local medical officers and their teams. And we're going to move forward strategically to make sure that we protect the most vulnerable.
Follow up?
Premier, it just appears that according to the numbers in terms of who's getting sick, the younger group are vulnerable right now. And you mentioned about there's there's not a firm schedule in terms of supply. There is a firm schedule announced by the federal government and reiterated today. I recognize the delays, but also when you talk about phase two, those who work in grocery stores, teachers, it doesn't look like now that's going to get started on April the 1st. So there's more delays to come. Are you really targeting those who are getting the most sick right now and spreading COVID-19?
I truly believe we are. You see, the most sick that we're spreading were the plus 80s. I hear what you're saying about shifting over to get the younger people. Then Christina, what happens? We shift over to the younger people, and all of a sudden the 16, 70-year-olds start dying. You'd be saying switch back to the 60 or 70-year-olds. And to be very frank on your comment, no, we don't have a schedule. We know when AstraZeneca is coming in. Moderna changed 5 times. AstraZeneca, if you know when the schedule is coming in, then tell me, and then we'll all know, and we'll be able to really focus, on making sure that we get it out. I know it's landed on Canadian soil. That's what I know. Give me a date, and we'll be able to gear up the pharmacies and the primary care doctors. So, again, I understand the production flow and supply chain. And supply chain isn't working as well as what we expected to. And I just want to make another comment. Since the beginning of this pandemic, as I joke around with my other premiers, I don't know of any premier that's complimented the PM, the deputy PM, the federal government more than I have. But if things aren't flowing the way we should, I'm gonna call them out. Simple as that. So some media don't like it. Oh well. We'll get it done.
Last question.
From Nicole Lampa at CTV News Kitchener. Please go ahead.
Hi, Premier.
Hi, how you doing?
Now, just before this press conference, the University of Waterloo declared an outbreak in all of its residences with 21 cases, and they say it's linked to a large cluster which was announced previously, and we've been told previously that there were 56 cases in that cluster. What's your reaction to all of these young people getting, sick in COVID here in Waterloo region?
Well, I'm concerned. You have the 2 universities there and Conestoga, all in that region. And guys, I just have to tell you, I got young daughters myself. Don't be going out. Don't be hanging out. Don't be gathering in groups. And I know it's happening, not with all teenagers that age, but a lot of them are. What they're missing, they might be able to get through it. But what happens when you go home to your parents or go home to your grandparents and you just pass it on to someone? It's just not right. You got to follow the protocols. You may feel you're invincible. Well, I can tell you, talk to a lot of kids, younger people that are in ICU. It's terrible. So don't be hanging out this weekend. Don't be planning big family parties and big gatherings. We just can't have those.
Follow up.
Premier, you're aware that Waterloo Region's top doctor and top elected official have said on record that we are not getting our fair share of the COVID vaccine. They're saying they've raised their hands, been vocal in regards to getting AstraZeneca in our local pharmacies, and yet we do not have them. Can you tell us an exact timeline of when we can expect AstraZeneca in our pharmacies, and what is being done to ensure that the doses you are getting are being handed out evenly and fairly across the province?
Well, I'll pass this to the Solicitor General. Thank you.
So the expansion of the pharmacy rollout is ongoing. As you know, we started with just over 300. We have another 300 coming online this week. Again, we don't have the vaccine yet, but the pharmacies are lined up. We have a minimum of 3 pharmacies per public health unit, and there are increasing supplies in the works. As we continue to see expansions of the AstraZeneca vaccine, then we will continue to expand the pharmacy rollout. But we have a lot of pharmacies who are very excited and are looking forward to offering that AstraZeneca to their patients and customers. Thank you.
Thanks, everyone.
Okay, thanks, everyone.